He gives a thumbs up.
All right, then I'd like to call this meeting of the Medical Advisory Ad Hoc Committee to order. Roll call, the 3 board members on the committee are here. So first I would entertain a motion to approve the minutes from the last meeting.
Motion to approve.
Is there a second?
I'll second.
And all those in favor, unless there's any changes or notes, all those in favor say aye.
Aye.
All those opposed? And now I need a motion to approve tonight's agenda. If there's a motion to approve the agenda.
Motion to approve. Second.
And a second from Jack, I think that was?
Yep.
All those in
Yes.
favor say aye.
Aye.
All opposed? And then, now we will do a review of the progress for the guiding principles from Randy.
Yeah, well, thanks, Dave. We're going to do tonight is we have a number of things we're going to walk through with regards to our, just a data update. Kurt will walk us through that in just a few minutes. We'll touch base again on some of our internal processes, a report on the last few weeks. We would like to talk a little bit tonight about the vaccines and just kind of get a little bit of update with regards to the status of that with our younger population and our kids. And then we do have some questions that have percolated up this week that we would like to pose to the committee to get some feedback on, and then open it up for anyone else on the committee who has some other questions. To start with, Rebecca, if you would be able to bring up and share the data tables, and then Kurt, I'll let you walk through them and take a look at exactly kind of what we've been seeing the last few weeks, and then we'd be interested to hear from our medical professionals how that parallels what you're seeing in the clinic situation. So can everybody see the tables who's on Zoom? Has that worked all right? All right, excellent. I'll turn it over to you, Kurt.
All right, thank you. So this first table is really the monitoring of our staff and students who have tested positive, as well as our staff and students who have been determined to be close contacts. Our staff numbers have been pretty consistent. They haven't changed a lot. Recently, we've seen a little bit more positive staff incidences. Our student numbers, I think from at least participating in the Dane County Public Health phone calls, we're seeing more student positive cases, and certainly since last week when we went to full days, and now this week with our elementaries full days, as we're seeing positive cases in our student body, we are seeing more close contacts because the students are within that 6-foot range for that cumulative 15 minutes. So we are definitely seeing more close contacts, and we've seen an uptick in our daily numbers within the community as well as the school. And I'm guessing you're seeing the same thing in your settings as well in healthcare?
That's for sure.
So if you want to scroll to that table 10, Rebecca. So table 10 is the daily information, so the number of positives, the number of negatives, percentage, 7-day, 14-day averages, burden rate, and then that CDC value of new cases within a 14-day period per 100,000. Again, as you see those numbers, and there is another data table that has a graph of these numbers, but as you see these numbers and you kind of compare them to where we were a few weeks ago, again, it's referencing that uptick. Last week on the, was that the 8th? I believe it was the 8th. We saw 10 cases within the community, the Waunakee School District community, not the school district, but the entire community. which, we hadn't had a double-digit number in one day for quite a while. The nice piece is, we're back down into that 2 to 3. Since then, we're in that 2 to 3 range in the 4 days after that April 8th date. So, I think if you kind of put this in the context of our school calendar, those higher numbers are certainly kind of in conjunction, most likely with spring break happening, the Easter holiday, and families probably getting together. And that's probably why that happened. At least that's what we're thinking has probably happened, to make those numbers go up a little bit. Hopefully they now stay back down into that 2 to 3 range per day, and where we were before, and occasionally get a few zeros in there. Those are always nice days when we have a 0. But that's kind of where we are at this point in time.
Would be interested to hear what you're seeing in the clinical and hospital setting over the last few weeks. Are you seeing similar types of trends and upticks? Are there things that you're seeing as new trends developing? Just trying to get a sense of what you're seeing in your settings as well.
So I can go, we get way more phone calls on people that are in the last 3 days than we did last week. They're in a different demographic than we had before. They tend to be in the 40s and sort of the high school kids in my setting, at least. Which probably, and our hospital-wide, we have, they say, for weeks we ran into the 30s in the hospital. Now we're in the 5 or 6 in the hospital at a time, and the ICU is not stressed right now.
Okay, good. Dr. Potoff, Dr. Anderson, what are all of y'all seeing?
Yeah, a couple things. So one, as far as inpatient COVID cases, we have started to have an uptick. I'd say probably started, late last week. Certainly nothing significant, but compared to what was kind of a new baseline that we kind of held for, a number of weeks, we've now gone above that. And then just anecdotally, we talk with ED providers to see if they're seeing more cases. And starting Friday, our ED providers have started to note that they're seeing more COVID positive cases come through the emergency departments. So similar, not overwhelming, spikes in cases, but definitely a change compared to what we were seeing for a good number of weeks, which was, low levels. That's starting to pick up a little bit.
All right.
Yeah, I would agree with that. I just add one thing is that the age group does tend to be a little bit younger. I mean, if you look at the public health mass in Dane County, you can see that the teens in particular are going up a little bit. Whether that's spring break or not, I also was in a pediatric office doing rounds today, and they said they definitely see an uptick in calls similar to what Bill's talking about. So I think we're definitely seeing the younger age populations in particular, so teens, 20s, 30s, that's really the group that's being affected right now.
Okay. One question that I'd like to pose, and it's just something I believe that we've been seeing, and Jenny and Kurt have probably worked with this a little bit more, but it seems like we have kids who might develop like one symptom, and then over the course of the next 3 days, they go from 1 to 3, and by that time they've been in school for a few days, and then they are taking a test and coming back with a positive result, which is then causing us to be contact tracing for a couple days. So particularly with the spring allergy season, are you seeing kind of a mixing of kids who may have or individuals who may have like a runny nose type thing that then over the course of a few days kind of precipitates into something else?
So ours is exactly that. We're actually coming up with a protocol of what to do with the kid with the runny nose.
Okay.
Because statistically we say that's allergies and other years, and now we actually have to find a way to deal with it at the office so that we can let people, they don't all have COVID, but how do we manage?
Right.
Our staff is pretty well vaccinated. How are we going to let them in? What are we going? So there's again, like I said, with COVID, it's all change, and so that's the current change. Is like, what do we do with these minor symptoms that could actually be COVID, and how do we react to it now? So,
Okay.
If somebody has a plan, I'd like to have it.
I think just generically, we talked a lot about, new or worse or different. And so if somebody's had chronic and it's consistent with that, I think we've tried to give that guidance, but ultimately it's a judgment call. I think, and so yeah, I think there's got to be a low level or high level of suspicion. But if it's pretty consistent with what people have had before and they otherwise feel fine, is it like we'll say, it's a tricky slope there. I'm not sure there's a great answer. It's a lot of discretion, I think, and ultimately being tested isn't wrong ever.
Right.
You know, with those symptoms. That's the other thing. There's no such thing, I think, as over testing at this point, but some discretion definitely involved.
Yeah, Jenny or Kurt, you guys work with it more closely. Any questions or things that you have that would help clarify that, or any input you'd like? You guys go.
No. I mean, our protocol really has been, if we see students with symptoms, we are sending them home and recommending that they contact their healthcare provider and let the healthcare provider determine what steps they should take as the healthcare provider, whether it's issue an order to have a test done or come up with some other explanation for why they may have symptoms. We do get some pushback for that approach, but again, what we're trying to do is make sure that we don't have a larger outbreak happen. So, I mean, that's the approach we're using, and
So on the health questionnaire, if a parent marks that their child just has a runny nose and sends them to school and they don't have a fever, what happens in that case? Does,
you want to talk through
With
that?
just the runny nose
yeah, just a
symptom,
runny nose.
as long as they don't have a fever, they're able to come into school.
Okay.
If sometimes that happens when they're sent to the classroom, and then the teacher might, we might assess them later in the day because of, they're really having a lot of secretions or, can't really keep their mask on because of it, then, we might reevaluate. But if it's just that one symptom and they're managing through the day, then they are in the building.
Yep, and our staff do monitor for if a second symptom shows up,
Sure.
then that's different, and we do remove. So we're trying to manage the best we can, but we are getting, we know we're in the allergy season, so a lot of these symptoms are there. And it's just a matter of trying to be as cautious as we can without unnecessarily having kids not be in school. But it's that delicate balance.
I agree that the real message to families should be when this is new and different for the child, and just speaking from personal experience, that what we've all said, that if your child has a runny nose and doesn't normally get a runny nose, really if we can err on the side of caution and keep those kids home to see what transpires over the next couple of days, because quite often if it is COVID, you're going to see something else.
Great. Great. Dr. Anderson, one of the things you said was getting a test is always important to know. At this meeting in the past, we've talked about, because I know through the UW and public health, they've had access to the quick test for symptomatic individuals. We talked about that a few months ago. We decided at that time that that wasn't really a good model for us at that point. I know that there's some work being done to see if there could be supplies of those provided to schools specifically for not just symptomatic, but for other students or other individuals, students or staff. And then I actually was presented a survey today by the Department of Public Instruction in conjunction with Department of Health Services, where they were looking at if the state put together a program, would we be interested in something that it seemed like along the lines more of like how some of the UW systems have been, where you have a test once a week or something like that for kids. What are people's thoughts if those things come available and their utilization in schools? I mean, it sounds like a better option to me than just being able to test the symptomatic, but I'd like to get a little feedback on what your thoughts are on something like that on a more robust level if it was provided to us.
Yeah, I mean, I think my thought would be is if logistically you can carry something like that out, doing surveillance testing, especially in the demographic, those young kids who typically aren't going to have symptoms, might be a way to catch some folks who have the disease or likely able to spread it within your buildings. but otherwise go unnoticed. I think you've already mentioned some of the challenges with just single symptoms. It's hard to know if a runny nose is COVID or an allergy. So if it's doable, having surveillance testing might not be a bad option. You can get the details on whether it's antigen-based, PCR-based, things like that. But as a concept, I don't think it would necessarily be a bad thing.
Okay.
Yeah, I agree. I think the thing with the antigen, I think we talked about this before, is if you're using it as surveillance, you are going to probably have some false positives. And so you just need to know that that's part of the drill. So you have to accept that risk in that. If you're doing symptomatics only, I think that you may be able to differentiate and provide some value for some of those allergy, related kiddos. And I think that's, got some real value. I think the asymptomatics, you just got to remember that you're going to have some false positives and parents could get upset or give you that feedback, and you just have to know that going into it.
Okay. Very good. Thank you. All right. Any other questions on either the data or any of the pieces that might be related to the data and the topics we were just talking about? All right.
I guess I'm just curious in your contact tracing, if you've had a lot of spring break travel kind of feeding some of this, that's something that we don't necessarily always get a lot of visibility into. Is that a trend that you're seeing in some of the students that are turning positive here recently?
We've had some students who have tested positive who did travel during spring break. Again, it's always not necessarily clear or clear cut as to where the source actually was, but we have had students who did test positive who did travel during spring break.
Right.
It's not a lot, but some.
Have you had anybody that's been vaccinated come back positive?
We've had no staff who have been vaccinated test positive. Yes, no staff.
I mean, as we kind of look at the last few weeks, last week we brought back obviously our 7th through 12th grade students, and then this week we started off with our K-6. I think that there's kind of two parts to it. I think when you start to look at it from an educational standpoint, having kids back in school, back in a routine, we see a lot of positives that have come along with that. One of the challenges, as Kurt has shared, is as we do have a positive case come up in the schools, particularly at the secondary level, because they do switch classes, you do impact more kids through close contacts. So I think one of the things we've talked about in these meetings previously was kind of the ability to manage the protocols and the processes. I mean, Jenny's been very involved as well as many of our other contact tracing folks to kind of stay on top of these things. But it's definitely added to the workload piece, and it's added to us having to quarantine more kids. Now, as we've said, it's kind of you're going back in time, so the time that they're actually missing by the time we catch it is a few days, and then being able to have a positive test or a negative test, have a test that comes back negative in order for them to return during kind of the requisite time frames. That's really the process we've been following pretty diligently. But that's definitely been a piece that's been impactful to our schools and the process, and also to the families whose kids have been deemed to be a close contact. So from a process standpoint, there's some positive pieces of getting more kids back, getting our educational system kind of moving, and some of hearing from like our students at the school board meeting last night, the positive impacts that they have. But certainly a consequence of having more kids in more closer proximity as you have a situation. We are having more close contacts, and we're dealing with that right now pretty much every day. So those are kind of the things that we're seeing within the system. I mean, anything to add, Jenny or Kurt or Brian? You three work very diligently with that every day. Yeah. Okay.
I'm assuming the way the classrooms are set up now, is it pretty much a 6-foot parameter, the first row, everybody around
Yeah.
somebody?
There's
Or do you get two seats over?
Yeah, so I mean, I've had a lot of conversations since secondary students have come back, and the challenge is just body density, and I think staff-wise, all of them speak to the desire to spread the students out as far as they can, and to the degree that they can, and it is kind of what you described. You know, the limits of, you know, the inner ring, if you would, right? Those first students that are nearest to the positive individual are the ones that are, you know, by nature of spending 15 minutes more in a class, seated inside that 6 foot radius, or excuse me, 6 foot radius, they're getting captured as a close contact. It's not been in the classrooms really at this time. There's not been a lot of, at least we haven't run into yet, activity that has led to close contact. It's been more about proximity, I would say.
Yeah. Yeah. The other piece, just to share for those of you who maybe don't have high school kids or middle school kids, one of the things that we've done is we've purchased 8-foot white folding tables, kind of like the ones you see in the boardroom here, but 8 foot long versus 6. And then on each side of those, they have a QR code where a kid, when they sit down, they actually QR code in so we know where they're sitting and who they're sitting next to. And that's really a process to be able to determine that if there is a close contact, kind of who they were sitting with at lunch, and trying to control that situation as much as possible. And then at the elementary level, there are generally assigned seats within the classroom, so there's a little bit more cohorting that goes on there. So we can track that at a better level. But that was definitely a piece that we wanted to see how we could put some additional tracking mechanisms in place. So that's really what we've been launching the last few weeks.
Can I ask, do you guys notice, is there like a pattern, are you getting the school context, or is it going to be in other words, from the proximity, or is it from, do the contacts look like they're coming from like other things, like in the hallway or in at practices, or where are you getting are you getting clusters of positives from the school, from the seating at school, or is it, do you notice it at all? Or when you're doing those testing, when you're doing that tracking, are you getting positives from the neighbors of that kid?
Are we getting
Oh, you mean are the close
spread?
contacts
Yeah,
turning into
close
positive cases themselves?
Yeah.
I mean, I would say we've not seen a pattern of that yet. I would say that our most consistent, when we start to see a close contact turn into a positive, have typically been contacts that occur outside of the classroom. And even, I think it would be fair to say, even necessarily outside of our activities.
Right, that's what I believe.
You know, whether it's a personal contact or a recreational contact outside of kind of the school context is where we're seeing more of that.
So it looks like the spacing is sort of, it feels like the spacing is working to me. It feels like the contacts I'm seeing are, like you're saying, they're secondary outside of school, or secondary to.
We don't have any evidence right now that it's spreading like between me and Dave, but if I was positive, it's going to put Dave into a quarantine for a period of time. So we are seeing that, but we obviously are seeing some of the COVID incidents coming in, and then as we see some of them develop, it's usually, as Brian said, based on some other contact that's occurred and that we can track back to some other place. It could be a relative, it could be a friend group, it could be an event.
That's what we're seeing.
And I think that's why some of the numbers in the spring break thing were families traveling together, and then both families ended up positive.
And families
So
being
that's
home and
the thing.
taking the test on the 8th.
Yeah. Right.
That was two things.
We got home, we're gonna take the test.
Yeah, we're also looking at, obviously, as we get further into the spring and some of our activities now, a lot of our activities as kids are in are outside. So we're managing through some of those pieces. We presented to the board last night of wanting to keep our spectators with face coverings on during all of those events. We'll follow the WIAA rules for face coverings. We've identified that with regards to the Badger Conference to have some consistency. So we are trying to kind of continue some of those things even when there's not specific public health orders that really mandate those. So those are some pieces that we're trying to do to also mitigate that. I did put the health check form on here. I don't need to discuss that this evening. One of the things we had initially thought was, at what point do we continue or discontinue that? As we reviewed kind of our protocols and our policies that we have, one of the things that we do have is trying to mitigate the kids coming to school and looking at symptoms. So we felt that that probably should maintain there, and that seems to be definitely a continued emphasis and probably a greater emphasis within some of the public health orders right now or recommendations is to vaccinations and watching symptoms. So we decided at this point we'd probably just keep that, so I don't need to really address that. Looking for a little bit of feedback on vaccines tonight. Certainly we had a little bit of information that came out in the news today about the Johnson & Johnson vaccine, but we're also interested just to know where do you see things going with, are you seeing more kids in that 16 plus age coming in to get vaccinations? And then also, where do you see the future is for like the timing for like that 12 to 15 age group?
Sure, I can take a crack. People can fill in. So 16s and 17s, I think right now in Dane County, we're around low 20% for having received a single dose. So that's been going up, and you know, the majority of them just becoming eligible here in the last week and a half or so. So, and really a lot of those appointments prior to their eligibility had already been taken. So hopefully we'll see some trends upward as far as that goes. Obviously the J&J news doesn't really apply to 16 and 17-year-olds, and I think we have reasonable supply, and the J&J supply wasn't going to be great for the next couple of weeks anyway, so we'll see what comes out of that. Related to the 12 to 15s with Pfizer, so expecting that to be going forward here to the FDA pretty soon, and there's some discussions about, you know, the process with that, but I think that the going thought had been July. I think I wouldn't be surprised if it's earlier. I think a lot of it's going to depend on demand, so when the adult demand starts to lag, I think we're going to see the 12 to 15s coming up. So I wouldn't be surprised to see that in June or even maybe in the latter portions of May, depending upon how quickly the FDA acts. So it could come sooner than later at that point, but I guess we'll see.
All right, awesome. Matt, what do you see as kind of the trend with the Johnson & Johnson piece? I mean, obviously they paused it here today. Do you see that potentially being a long-term pause, or is that kind of just a short-term piece until they kind of figure out what's going on?
Yeah, it's going to be interesting. So you're talking about 6 cases out of, you know, close to 7 million individuals receiving the vaccine. You're also talking about, you know, I think they all were reported as female between 18 and 48. So I think we're going to know probably more here in the next week as FDA and CDC dig into the specifics of each of those cases. So whether that will be, you know, a long-term pause or declination, or whether it's going to be nothing, or whether it's going to be specific to a particular gender age category for certain types of risk, I think we'll know more about that here in the next week or so. The main impact with that is going to be if, for example, let's say they didn't renew the EUA, they didn't take away the pause, it's just going to alter supply. But I think the other thing with that is that the Pfizer and Moderna supply has gotten to the point where it is pretty good. And so I think that we're going to see in the next, probably, you're already seeing in some parts of the states, parts of the country, unused vaccine going on. So in Dane County, we've been fortunate to have really good uptake, but I wouldn't be surprised if vaccines much more widely available in the coming 3 to 4 weeks, even here in Dane County. So kind of follow that closely, but I think we're going to be in okay shape.
All right. One of the questions I know that our contact tracers receive is feedback on people who have received the first shot in the vaccine series, and then we're coming through and they are deemed a close contact. And per the protocols that we're following, until you've had the full sequence plus 2 weeks, we do need to implement the quarantine procedures. We just wanted to kind of bring that here and see if that's kind of resonates in the same way with you all, but that's generally what we're hearing. And do you see any of that type of dialogue changing at this point at all?
So I'm a little simplistic on this, but I go, to me, the first shot sort of protects you, the second shot protects everybody else. So I'm definitely with protect others still, and I don't know how you guys feel about it, but that's how I feel about it. The first shot probably does keep you from ending up in the hospital, but the second shot's to keep everybody else from the hospital. So.
Yeah, I think it's probably a good process that you have right now where, you call fully vaccinated, 10 to 14 days after your second dose of Moderna Pfizer, 10 to 14 days after your single dose of Johnson & Johnson. There have been people who have crunched the initial EUA data trying to look at what efficacy might be after one dose, and it might be okay. At a minimum, probably 52% efficacy, maybe up into the 80s. But part of the problem there is those studies weren't actually designed to look at single dose efficacy. And I think it's somewhat telling that, nationally, we haven't gone to single dose regimens. That would be a way to vaccinate people much more quickly and logistically in a much simpler way. But the data is just not quite there to say that after a single dose, you're good to go. Hopefully someday we do have those studies that kind of reassure us about that. But I agree with what you're doing. I think right now you just can't say that a single dose of Moderna or Pfizer qualifies as being fully vaccinated.
All right, great, super. Jenny or Kurt, do you have any questions on that, or does that clarify your question?
I have another vaccine question.
Oh, perfect.
I guess. I guess actually this is more of a public service announcement because I know some people are listening to us tonight. And we have started to see some students going through the vaccination process, and we've actually had a few who received their second dose already. I don't know how they got earlier than the date, but some did.
Lizard on the highway.
I don't know how, but they have. And so here's the public service announcement is we do not need parents to automatically provide us with proof of the vaccine. As a school district, we have access to the Wisconsin Immunization Registry. And so what we did to our protocol, our contact tracing protocol, is we added a series of questions related to students and the vaccine. And we start out with, has your student started to receive any of the COVID vaccines? If the answer is yes, we ask them, how many doses? If they say 1 dose, we recognize that. If they say 2 doses, then we ask, what's the date of your second dose? And then we will verify, we will go into the Wisconsin registry and look and see if it's in there. If it's in there, then we can verify all of that information. If it isn't there, because there's sometimes a lag between when a person receives it and when it shows up in the registry, if we do not find it in the registry, then we will ask the parent to give us a snapshot of the documentation that they have that they've received the vaccine. So we don't need parents to provide that to us unless we aren't able to find it within the Word. So that's kind of my public service announcement for parents who are listening, that's kind of the process that we are using to verify if a student has received the vaccine and if they're fully vaccinated or not. So I just wanted to share that for everybody who might be listening right now.
Excellent. Great. Thanks, Kurt. I think that came to kind of the end of the questions that I had that we had generated. Are there other questions that anyone on our committee has that they'd like to post tonight? Or any information that they'd like to share?
Well, seeing none, Randy and I had a brief discussion before the meeting about the concept of future meetings. Based on the fact that usually these meetings are very helpful for the board as they're looking at opening up other programs or deciding what guidelines to have programs under. Our next meeting we're actually fairly close, so another meeting of this committee before the next board meeting would probably be too soon. So we were thinking that possibly a meeting before the June meeting would be good. So we were looking at doing that the week before the June board meeting would probably be the next time that would be useful and helpful to take a look at where the community is at. Do you have a date that works best for you?
Hold on.
And then I'd like to congratulate Dr. Potoff on his induction into the AOA Medical Honor Society. We're so lucky to have somebody on our committee.
Thanks for the congratulations, appreciate that.
There you go. And for those of you who are parents, just to let you know, those 8-foot white tables with those QR codes, will be for sale at the end of the school year. So you can have a COVID honorary WCSD table. So ask your student which chair they were sitting at and try to get that table at the end of the year.
Okay.
Randy promised to sign them for anybody on the
Oh,
committee.
there you go. If not this year, next year.
Yeah.
It'll be for sale. We'll have to kind of make sure.
Yeah, you
we
better
get
wait.
through
Yeah,
all
Yeah,
the
hopefully
parties.
hopefully we
Don't
don't
get
need the
that far.
table.
But I don't need them, but I'm not selling them.
Now we're
cheap.
jinxed for sure.
We may have to delay one semester
There
or
we
two
go.
on the sales. Let's hope
Yeah,
not.
they're pretty nice though. All right, so what about like June 7th? That's Monday this, or we can do the, if we want to, where are we running today? Today's Tuesday. So June 7th or 8th. Monday's the 7th, Tuesday's the
Is there anything?
Randy, when is the last day of school?
8th. The 9th, I believe. So this would kind of be a point right before we hit summer school into our summer programs and a week before our board meeting.
Yeah, we thought.
So would we, so would the purpose of the next meeting then be to talk about summer school? Is
It
that,
would probably be similar to what we did tonight, to touch base, see what's changed, if there's anything in the landscape we want to talk about. I mean, I do think we're kind of running to the point where this committee has really served its primary function. I hope that as we kind of get into summer, that we don't see that this needs to be a ongoing committee next year, but I guess as we've discussed it, having at least a meeting in June as a touch base to see where we are and what progress we've made, and if there's any things that we need to clarify for summer, that'd be at least a good point to touch base, and then we can finalize our work.
thanks for the clarification.
Yep. So 7th or 8th, either one of those work better for anybody?
7th, I will not work from now.
7th doesn't work? So why don't we do, what about the 8th? Tuesday, the 8th?
Yeah, that sounds good.
All right, let's just do that. So June 8th at 6 o'clock. Awesome.
All right then, if there's no other questions or comments, then always, if something comes up between now and then, of course, shoot us an email, let us know, and we can react better, obviously, than waiting. But other than that, I take a motion to adjourn.
I'll move to adjourn.
Motion to adjourn?
And a second from Jack. So all those in favor say aye.
Aye.
And again, as always, thank you so much for your time and your help with helping the school district deal with this and be as open as we possibly can. Thank you.
Thanks, everybody. Have a great night.
And now I need to run home and get on my
There you
DEI
go.
book study.